We're making great strides in cancer treatments and prevention, but breast cancer remains the second leading cause of death in the U.S. Early screening and detection are key, and today we have Dr. Meaghan O'Malley to talk more about this.
Yes,
welcome.
Thank you. I appreciate you having me.
Oh my gosh, the pleasure is all ours. So, doctor, talk about why awareness is so critical in the fight against breast cancer.
Absolutely. 250,000 women will be diagnosed this year of breast cancer. That's 1 in 8 women. And that's a statistic that most of my patients and even my friends aren't aware of. So this is really important for women to know in order to take control of their health and get the appropriate cancer screenings, because early detection truly is key.
That's so good to know. And you have a special partnership right now with the Seattle Seahawks called Crucial Catch. If you can explain more on that.
Yes, absolutely. So Virginia Mason Franciscan Health have partnered with the Seattle Seahawks to promote Crucial Catch, Intercept Cancer initiative in order to boost screenings and obviously awareness about that. In fact, we're the only partnership that has on-site cancer screenings at some NFL games. For example, there is an on-site CT scanner that can offer low-dose radiation CT scans for people to screen for lung cancer if they qualify, as well as on-site blood testing for PSA for prostate cancer screening.
That's amazing to have on site. And what options are some other screenings that are available if you maybe go in as well to the office?
Absolutely. So annual screening for mammography starting at age 40 is key. Early detection allows us to identify breast cancers at an earlier stage, smaller size, with a higher likelihood of cure. So definitely annual mammogram starting at 40, regardless of family history.
Wow, okay, I know, because I feel like there is a lot of confusion sometimes on what age, how many times a month, or how many times a year. So you're saying 40, starting at 40, right, is what people need to know.
It has been confusing because there had been differing opinions amongst various professional groups and screening task force guidelines. This year, 2024, all the major professional bodies and task forces are now aligned. Annual, starting at 40 every year. These are covered by insurance. They're easy. On my 40th birthday, I actually went in for my mammogram.
That's how you celebrate. Good.
I was so excited.
Oh, yeah. That's amazing. And we've made so much progress in research and the way that we obviously treat this. But what do you want patients to know?
Well, there are a couple things. One thing that's really a hot topic right now as well is breast density and whether women need to have additional screening with breast MRI. There is a role for that depending on if a woman has an increased lifetime risk of breast cancer based on risk factors and family history. There may be a role for additional breast MRI screening, and of course, when in doubt, always ask your doctor. But I think the other really important thing is that as research advances, our care advances as well. And if you or a family member are diagnosed with a cancer, we have multidisciplinary cancer teams that take you from diagnosis to hopefully recovery.
So what do you say to women who have no family history or symptoms? Should they still start screening at 40 years old?
Absolutely, they should. 75% of women have no family history or known risk factors. 75% of women diagnosed with breast cancer. So this is not something that you can only seek care if you're having symptoms or you have a known family history. The screening guidelines for all cancers are trying to keep up with changes in how things are being diagnosed and at what age. In fact, the recommendations for screening colonoscopy were recently lowered from age 50 to age 45. But this is definitely something we want to make sure women know about for their mammograms and any other age-appropriate cancer screenings.
This is such good information. Thank you so much for being here, Dr. O'Malley. And remember, like she said, early detection is key. Schedule a screening and encourage your loved ones to do the same. And to learn more about Crucial Catch, go to the website that you see right there on your screen.
This special presentation of New Day Northwest, sponsored by Virginia Mason Franciscan Health.